Greetings, Professor. This is my week 5 diabetic assessment. As you know, I'm already type 1 diabetic, as I've been explaining throughout these weeks. So I went ahead and answered the questions to pertain to the symptoms that I had when I first got diagnosed. So that's the way that I'm going to approach this journal here. So it says examine the results of your assessment and you identify your risk of diabetes. Is there a history of diabetes in your family? Yes. Do you tire quickly or seem always to be fatigued? Yes. Do you urinate frequently? Yes. Are you constantly thirsty? Yes. Is your vision blurry? Yes. Have you suddenly lost weight? Yes. Are you overweight? No. Do you eat excessively? No. Do your wounds heal slowly? No. Is your skin frequently itchy? Yes. Yeah, so when I first got diagnosed as a type 1 diabetic, I had all those symptoms. I lost 50 pounds in about 4 days. Uh, I was in class one day and the words were starting to separate. When I was looking at the board, they were like red and blue. And unfortunately, my vision got very, very blurry. And I was urinating like every 5 minutes. And I didn't know what was going on at first when I first got diagnosed as a type 1 diabetic. Um, so that's kind of small detail and some symptoms that I had: frequent urination, the vomiting, and the weight loss. Okay, next question. Examine the relationship between health and wellness by discussing the impact of diabetes on at least 3 dimensions of wellness. Okay, so the three that I chose were spiritual, emotional, and physical. Spiritual, you begin to lose faith in yourself, continuing to ask why this happened to me. You get really, really down on yourself and you just lose faith in everything. Lose faith in yourself, lose faith in people, and lose faith in the universe even. Okay. Emotional, like I said, you're always asking why this happened to me. It's hard to cope with. You're stressed out. You become burnt out. Wanted to deal with the disease every day. Um, and that can cause you to get sick as well. You don't want to be around people because you don't think they'll understand or they don't support you. You start to feel alone, um, and you just don't want to be around anybody. Okay, physical. Like I said, you start to feel sick. Your body starts to shut down. So you definitely want to stay active every day. You don't want to lay around all day and do nothing. This will actually cause your disease to get worse. Uh, You want to keep your blood sugars regulated. You want to keep your blood sugars in range. The ideal blood sugar range is going to be from 80 to 120 reading when you're checking your blood sugars. So you definitely want to keep those in range because if not, it not only causes your disease to get worse, but other organs begin to shut down as well. And you start to, feel headaches. You start to feel dizzy some days. Some days you just don't want to get up out of bed. So you definitely want to stay active. Lifestyle habits. Yeah, you want to stay active. Watch what you're putting into your body. Watch how much you're putting into your body. You want to practice a good method to prevent actually type 2 diabetes as well. A good method is to actually instead of eating big meals all in one setting, practice portion control. You definitely want to practice portion control. That helped me a lot as well to not become obese. Definitely, like I said, you want to either get in the gym, just go for a walk, get outside. Even if you have to, even if you live in an apartment, just walk around the apartment. You definitely want to get outside, get active. Um, Make sure also that you're getting the proper amount of sleep as well. This will prevent you from you being fatigued and your body getting into a system. Also, you want to, if you can, follow up with your primary care provider at least twice a year. Um, do blood tests that'll test your A1C. That way, you'll actually know if you're on the path of becoming a diabetic, either whether it's type 2 or type 1. So also, yeah, definitely get blood work. Um, so that way, ask your doctor. Can we set up A1C test, and they'll be more than happy to help you. All right. This has been my journal, and I hope this helped. Thank you.